My name is Mahal Barak, and today me and my group we're going to present our research project which focuses on the awareness of indications and complications of sleeve gastrectomy in Riyadh city, and it is supervised by Professor Khalid bin Abdurrahman. So to start off, obesity is a leading cause of many major health problems worldwide with many harmful complications. So sleeve gastrectomy, which our research focuses on, is known to be the most effective treatment modality to treat morbid obesity based on many references. And also, it is the most commonly performed gastrointestinal surgical procedure due to its effectiveness. So, the aim of our study is to measure the awareness of sleeve gastrectomy complications and indications among Riyadh residents, and also to determine if there's an association between some measurable factors as age, gender, level of education, and the level of awareness. And the awareness, which this study aims to measure, include the procedure itself and the post-surgical complications.
Assalamu alaikum everyone, I'm Al bin Saib. Today I'm going to present the method that we used in our research. So first of all, it was a cross-sectional study that included 1,700 participants. The study was conducted between October and November 2020. The study also targeted individuals who live in Riyadh, KSA, and who are aged from 18 years to 65 years old. In general, participants were asked about their awareness regarding sleeve gastrectomy complications. Regarding the study sample, it has been calculated with a 95% confidence level with a 3% margin of error. The data collection method, we collected the data through an online questionnaire via Google Forms. And lastly, the result. The data will be programmed into Microsoft Excel 2013.
Assalamu alaikum wa rahmatullahi wa barakatuh. This is Nurum Demir and I will present the results. The number of respondents allocated was 1,700. We categorized the respondents' result into 4 categories. The first, which demonstrates the socio-demographic characteristic of the participant, which shows that the female dominated the males with a percentage of 67.4, and the most common age group was from 18 to 20 years old. The second table about health status of participant indicate that the majority of participants did not suffer from any chronic illness. And the third table about the background knowledge about sleeve gastrectomy indicate that the majority also of participants answered yes regarding the question about history of having sleeve gastrectomy surgery, whether it was themselves or their friends or family members. And the last table about participant awareness towards sleeve gastrectomy complication indicate although the majority of participants were familiar with the complication of sleeve gastrectomy, however, 33.1% of the participants did not acknowledge the complication of sleeve gastrectomy surgery. A decent awareness among the populace about sleeve gastrectomy complication is crucial to ensure that affected individuals seek medical advice for weight reduction. Many factors such as educational level, personal experience, and lifestyle modification after surgery and individual experience may affect an individual awareness. In this study, we aim to assess Riyadh citizens' awareness of sleeve gastrectomy indication and complication. The results showed a moderate level of knowledge, especially to those who age, as we said, from 18 to 20 years. A female participant also, as we said, showed an increased level of knowledge more than males. Most of the participants did not acknowledge their BMI, and most of the participants did not suffer from any chronic disease.
Assalamu alaikum, my name is Reem Al-Gublan. I will talk about the conclusion and discussion. Our study shows a moderate level of awareness of sleeve gastrectomy indications and complications in the study population. To some point, there is a level of knowledge in most participants indicating that bleeding and infections along with vitamin deficiency might happen as a complication after the surgery. So we need to increase social awareness about sleeve gastrectomy to ensure that our community is at a significant level of knowledge and awareness. The limitations of our study were low responses of male participants, and that might affect the results of the study. Sensitive nature of sharing personal information like the weight and BMI of certain respondents may contribute to low compliance or inaccurate answers. Also, need for long-term observation studies to assess the long-term effects of bariatric surgery on the quality of life.
At the end of this presentation, we have covered the main points of our research, which include the introduction, the aim of our study, the method, the result, the discussion, and finally, the limitations. And these are our references, which we use in preparing this research. This research has been done by Al bin Saib, Reem Al-Gublan, Mahal Barak, Nuram Demir. Thank you for your listening.